The Gauteng Department of Health has denied that patient care was compromised in any way due to hot water and food supply challenges at Charlotte Maxeke in Johannesburg Academic Hospital. The department says that issues with corroded water pipes were being taken care of and that the issue with food supply compliance in March is on track, with patients receiving 3 meals a day. However, critics said that the situation is not that healthy. We now speak to spokesperson for the Gauteng Health Department, Motalatale Modiba. Motalatale, thank you so much for joining us and a very good evening to you. I want us to start with what the situation actually is, because we've got reports from the ground saying that there are food shortages, that staff has now also resorted to buying food for some patients. They also do get into trouble for that, patients' family members are also now having to bring food to them. What is the actual situation?
Thank you, Maxeke, for this opportunity. I think it's important that we once again reiterate the fact that at no given time was patient care compromised. The situation as we speak now is that patients continue to get 3 meals a day. They continue to get food that is nutritious as recommended by the nutritionists within the facility. Yes, we did have a challenge at some point where the supply to the facility was affected. It was affected because the Maxeke cooked freeze, which supplies the facility with prepacked meals, had a challenge where the municipality had issued an issue of non-compliance because the water that they get had an issue in terms of it being tested. And by the way, that is municipal water coming into the very same facility. So that matter was cleared. During that period, there were certain food items that were not really accessible to the particular facility. But there was never a time where patients were not being given food. Maybe they might have not been given certain types of food that they would have preferred, but at all times, we ensure that patients continue to get 3 meals a day. That matter has since been resolved because food is being delivered to the facility, because that facility gets prepacked meals from the Maxeke. That is for lunch and dinner. For breakfast, they prepare on site.
Are you not in any way downplaying the problems here? Because there clearly was an issue, and you saying yourself that there were challenges. These challenges, however, were not due to any patient or resident or citizen as wrongdoing, but there were challenges from an official point of view, whether it's the municipality or your department. The fact that there were challenges when it comes to something as basic as food, that's problematic.
Sometimes it can happen that you don't have, let's say, chicken, but you provide something else instead of chicken and all those things. We were not denying that there was no period where there was a challenge with the supply. Well, the first one is that, in fact, it is the facility itself that proactively communicated with patients. If you look at the circular, the internal circular that the CEO of the facility issued to staff and even to the patients to say, during this period, we've got this problem challenge, this is how it's being addressed. It's not something that suddenly got revealed by someone out there and all of those things. Of course, the matter maybe is made news for someone else to make it an issue as such, but it's something that would have been communicated proactively by the facility concerned to say, at this point in time, we're having a challenge with this, but the patient care was not compromised. Remember that in our facilities, we've got nutritionists who know that if you can't get the protein from meat, they can give you something else that will still give you the same proteins and so forth. But I might be preferring a particular type of food item because I'm used to that particular food item. So we're not saying that there was no challenge. We are saying that, yes, there was a challenge with the supply during that particular period, but patient care was not compromised in terms of, we know that patients must have nutritious meals for them to be able to take their medication. And we've got nutritionists on site at the facility whose job is to also look at ensuring that patients continue to get that type of care so that they can then be able to take their medication properly and all of those things. So the issues of preferences is something else that we can, I think, probably debate around. But the bottom line is that we did not have patient care compromised.
And as you're saying that, I think there are people who are watching this who may have felt compromised, or family members who had been compromised in some way, because there were those reports and there were those allegations by family members to say that they had to bring in their own food. We also know of previous cases where nursing staff and medical staff has gone out to buy food for patients because they can't give them medication on an empty stomach. So there clearly is a problem. But, and I hear you saying that part of it has been resolved and patient care wasn't compromised, but how did we get there in the first place? Can the department not sufficiently run their contracts that they don't come across such challenges, that food is not an issue?
The issue was not really that there's a problem with the contract. Remember, Masakani Food Freeze, it's our own entity. The issue was that at the municipal side, they had said that they tested the water and the water had equalized, so they could not allow that Masakani Food Freeze to continue providing food. Remember, it provides food to several facilities, and we only have a complaint in one facility out of over 20-something facilities that is provided. So it tells you that if you look at where the facilities, where the complaint is coming from, it's an issue of preference. Patient care was never compromised. And when we say patient care was never compromised, that the issue of preference, and I repeat again, the issue of preference of saying, I prefer this food item as compared to that food item, it's you are still getting the same nutrients that will ensure that you can take your medication. Because when you say patient care is compromised, it means patients, one, slept without eating, they went for just without eating, and they could not take their medication because they were not being given full supply. In this instance, that's not what we're talking about. We're talking about a shortage where certain items would have been not available because the person that provides those items had to deal with the issue that the municipality had raised. And they dealt with those particular issues, and the situation was normalized. So it was a specific situation that was dealt with, and it affected that particular facility, and it has been resolved. So I think on the issue of patient care, we're quite clear that while we might have had this challenge, we still continue to maintain the level of care that we need to give to the patients that are at the facility.
I want to move to the issue of hot water as well, just to get clarity on there. There were those reports and allegations that there wasn't any hot water. Your statement from your department said only 2 blocks of the hospital have been facing challenges with hot water supply for a couple of weeks as a result of corroded coils. One, why are you saying only 2? There should not be any in the first place. And 2, why are these coils getting corroded? Is there not sufficient maintenance that's taking place?
There is maintenance that takes place.
So why are they corroded?
Perhaps the easier way to explain it is this way. You've got a car that you drive all the time. You take it to maintenance every 15,000 kilometers and all of those things. But the fact that you take your car to 15,000 kilometers doesn't mean that after service, your car might not have a problem, let's say, with your injectors, because injectors are part of your engine component. You might still experience a challenge there. So the fact that you've got a challenge with injectors, it doesn't mean that the car is not be saved. Maybe to explain this, domestic water supply in the facility uses steam in what we call calorifiers. These calorifiers are what we call heat exchangers, where steam gets pushed through the system using coils to heat the water. Now, these coils, they last long, and they're not what you call your on-the-shelf items. It's not something you can go and just order tomorrow. It takes weeks because they have to be manufactured at that time, because even the manufacturers don't keep them in stock, because once you put it in, it lasts for a very long time. So you could be servicing your machines and all those things, and there's nothing wrong with your coils. But at the time when you then experience a problem, you place an order, as it was the case in this instance. It's just that the lag time was about 4 to 6 weeks in terms of the coils being able to be manufactured one and then get delivered. They've been delivered on site. Already the contractor is on site. They're installing for one block, and when they're done, then they'll install for the other block. I know some people say, but why can't you buy these things and stock them? You can't buy and stock them because it's like your other components of your engine that you're really not going to keep them. It's not like breakers that you can just wear and replace. It takes time in terms of them being manufactured, But also, you can only procure them at the time when you have a challenge with those particular areas. Even with this, patients that are in those specific wards, in the two blocks that I'm talking about, were communicated with, including staff said, we are going to be doing this maintenance during this particular period. This is the inconvenience that will come, but the alternative arrangement is that there are wards that are adjacent to the two blocks. Then hot water will be then be drawn from there. Obviously, it's an inconvenient situation in the sense that it's not the normal way in which people are used to getting their hot water and all of those things. But it's even with maintenance, it's not a lack of maintenance. The component that got broken now is not one of those that is off the shelf. If you took us an off the shelf item, that thing would have been sorted out within a matter of a day or two. But the fact that you have to wait for 4 weeks or so for it to be manufactured because it's a specific type of an item for it to be brought in. Once you've installed it, the coils they last for a very long time. That's why it's not items that you can really say you're gonna buy many of them and keep them in store.
Motalatale, really appreciate your time this evening.